Number 3 is plan and assess.
Yes. So you always want to just kind of assess the situation. And, you know, as caregivers, especially if you're caring for a loved one and you're doing that day in and day out, you pretty much have a routine, but you still want to continue to assess your situation, you know, especially on things like sliding them up in bed or repositioning them in bed.
Yeah.
And making sure that you are giving yourself enough space when you're working with them to be able to bend your knees and stick your rump out,
Gotcha.
you know, and keep your head and shoulders up. A lot of times, especially if you're working and trying to get them up in bed, sometimes if it's a hospital bed, we'll go to the top of the bed.
Yeah.
And a lot of times there's not enough space between the bed and the wall or something like that. It's just, you always need to check your space, check your situation, and if you're doing it for the first time, you need to really assess that person and say, you know, do I have the physical strength to do this on my own?
Yeah.
Because it only takes one time.
Yeah, absolutely.
You know?
Because that person might be bigger than you. You know,
Right.
in therapy, we would always get we would have these smaller therapists, usually
Right.
females, and they would have a bigger male patient. And I mean, you know, you've been taught in school,
Right.
you know, how to block legs and, you know, help
Kind of leverage
yeah,
that.
and leverage your weight against their weight and everything. But it was always scary for them, which I totally get it. But you know, that person has planned about how they're going to go ahead and get that person transferred, or they've asked for help.
Right. And sometimes that plan involves equipment.
Oh yeah, absolutely.
You know?
Yeah. And as far as you know, planning ahead, I've noticed sometimes whenever you transfer a person, let's say you're transferring a person from a bed to a wheelchair, I've noticed that you will, when you're planning ahead, that you will bring the wheelchair as close as possible and plan ahead and put it at a certain angle.
Right.
So that, you know, when you do a pivot transfer like that it's not, you know, it's going to be easier on you. I think that would be included in planning ahead as well.
Oh, absolutely. You know, foot positioning, counting, you know, planning ahead as far as communicating with your loved one.
Right.
Because, you know, if they can help, you want them to help. We're going to talk about that. But, you know, even counting, you know, and saying, okay, I'm going to count. This is what it's going to be. We're going to go on 3. So I'll say 1, 2, 3, and then we're going to go.
Yeah.
Or we're going to go on 3.
Yeah.
But make sure, you know, just like that instance,
Right.
you want to make sure that the communication is there and that you've planned ahead to do that.